Let's welcome Aileen Jong, who is a friend of mine over 2 decades almost, and we work together in many capacities over time. So she is absolutely wonderful person, not just a healer, and uh, very caring for the people into the offering different healing modalities. And the other part is also keep studying. So the in these uh, you keep growing as you study more, uh, you meet more people who offer more things, and then you study more. So she started with basically learning the acupuncture. She's also a master medical qigong therapist, and then she also works with all the age groups like children, then the women, then the families, and also specialize into the pain management. She also teach regular qigong, and she also offers the traditional Chinese medicine modalities, which has a lot of things to offer, like Makshibashan and Meridian and those type of cleansing programs. So she will be one who will highlight a lot of these things. We want to keep this session interactive, so feel free to ask your questions. I requested her to also give us some ideas and practices which can be practiced at home and also during these times. And you will see once she gets into the action, she will leave everybody very calm and peaceful in the end. So, welcome, Eileen. Thanks for joining us.
Thank you, Sachin, for the very kind um, introduction. I started in medical Qigong myself back in 1994 because I was really injured with back pain. I was in a very stressful job as a financier up in the city in San Francisco. So even though the New York markets and the San Francisco markets are different time zone, but you're supposed to do FaceTime and be there. So I was working 10-hour days and sitting for that amount of time back and forth up and down the train and not being very active, so badly hurt the back and have to be down for about 3 to 6 weeks according to your MD. And they increase pain medication from aspirin to Advil to Aleve. Okay, and it seems it didn't work with my stomach. So over time too, I got things like stomach ulcers, and because I was in the high stress job, I had carpal tunnel syndrome. Try to get active, re-injure yourself. So it was all this recurring cycle of pain and suffering. So I did go to find an acupuncturist, many acupuncturists, but I wasn't a very good student, good patient, because it seemed to be temporary. Has anybody had that kind of experience before? Then after that, I uh, finally, uh, after I had a foot fracture, I was crawling around my kitchen floor. My first spiritual epiphany is I asking the universe, okay, I don't know what's going on. As long as I can like walk again, I promise that I'll teach it to the world. Just walk, not asking for anything. All right. And then very soon after, when you put that kind of wish out to the universe, someone recommends somebody to you. My girlfriend said, go down to LA, find this doctor. Yeah. And then after that, she's the only acupuncturist who said to practice medical qigong. So uh, today, then I wanted to go on to talk to you about what factors would cause your illness or imbalance when you're in pain, right? We have things like accident, external things, injury, natural environmental disasters. Right now, we're having all these fires, these hurricanes, earthquakes, right? And food and water supply problems. Oops, let me just go back there. Excuse me. And economic problems, right? Social, political unrest, injustice, all this cause a lot of stress, right? And also external endocrine disruptors, chemicals that are in our laundry, pesticides, yeah, interrupting the food supply. But there's also one other thing about psychosocial mental health, your spiritual disconnect, and this affectation when you just kind of feel you can't do anything anymore, right? And that's where I was 20 plus years ago. And of all these factors, what's the difference between number 7 and everything else? Do you know? Any idea?
It's within yourself.
It's within ourselves, yes. Everything else is external. And one other thing, this one, psychosocial mental health, social disconnect, disaffectation. This is the only one where we have total control over it, as in our emotions. So what I'm trying to set the stage is in Chinese medicine, we focus on that, on balancing the emotions, because to us, most of the causes of diseases or illness, imbalance, is because of your imbalanced emotions. And so what does your pain look like? Yeah. Some people feel sharp, dull, acute. When I first had it, it was very acute because I injured myself exercising on the stair stepper. Not the why, but you know. And then it was for a long time, so chronic, and it was a lot frequent, and then now and then, but also maybe incident related, just because emotionally things happened and I would get the pain, and you kind of get tired of being sick and tired, right? And then it can happen in your head. You get headaches and migraines, which I also used to have. Okay, some people have clusters, some people it's the front, the back, huh? And you can have it also pain. People can have in the ear, your inner outer ear, ringing the ear. Your eyes can be sensitive to light, dry eyes, red eyes. Anything that I'm reading off and you see, yeah, just raise your finger so I know who's had any situation that causes difficulty for you, right, in your body. Oops, going back right there. Okay, your nose, people have constant dripping noses, rhinorrhea, it causes your pain, right? It keeps dripping constantly. And then, of course, with the pandemic now, we're always concerned about our low immunity, right? All this amount of stress will cause inflammation. Okay, and people also have pain and TMJ pain in the jaw. And I had also mouth ulcers because I wasn't sleeping well at the time, throat pain, your adenoids, everything's inflamed, yeah? So no fun, no fun stuff. Okay, and in terms of movement, right, it would affect your neuromuscular skeletal system. Okay, I'm just gonna quickly breeze over. Most of you can read everything that's there. And I wanted to know, because I had back pain, do you know what percent of the US population is affected by back pain? Read any stats?
You're just sitting.
Yeah, from sitting or all injury, doesn't matter. Whatever affects you. What do you know how many people, how many percent of the population will get some kind of back pain in their life?
Must be a high number.
80%. 80%. This is why we have an opioid crisis, right? Nobody wants to be in pain. It tells you something. It tells you that something's out of balance and it's cranky, and it's the highest cause of absenteeism. I mean, before COVID even, you see? Because there's something going on in your body that's not agreeing with you, right? And of course, it goes down through the body, your hips, your glutes, your thighs, calves, anywhere in your movement, locomotion area, right? And sometimes it's going to feel acute, dull, red, inflamed, blue and black if it's going on for a long time, okay? And that means it's affected your blood system already, right? Has anybody ever felt tightness, stiffness, swollen or puffy? Yeah, right? Um, and why does it happen? Sometimes we have the misalignments. There'll be wear and tear, and then from friction, maybe your shoe doesn't fit you very well, yeah, and then it causes foot pain that you're not aware of. And then also sometimes one side is higher than the other side. That's misalignments, and then you overuse it, right? You underuse it, yeah. I had a patient one time. She was working in Target right? They stand a long time as customer service. Say good job, right? But later on, there were all kinds of issues um, with the waste elimination system too. So that's all related as well, not just for walking. And I'll talk about that in a little bit. Okay, so poor core strength, poor nutrition, stress, insomnia, and your under-resourced patient. What's under-resourced mean?
Not enough help.
Yeah, that means you're not nourishing yourself enough. Because you got deadlines, you got family, you got kids, you got relationship, you got job or lack of job, right? Nowadays, yeah. So you're under caring for ourselves, right? Which was what happened when I used to be a financier. So okay, so those are external, right? In the walking system, your central nervous system, your appendicular nervous system. But then there's also pain within the internal organs, which means your inflammation, right? So then going again from top kind of to bottom, your brain and nerves, right? You would have either overfiring or underfiring sometimes. I've had those types of people come in as well. Again, respiratory, coughing, right? With phlegm or with blood. And your heart would be pumping the system through the blood vessels, but what if it's not pumping properly? What if you have high blood pressure, low blood pressure? Then it's not going to be able to nourish your whole system as well, right? And then your kidneys, urinary system, you can have therefore painful urination. Okay, I specialize in fertility cases also and women's cases, so UTI is a big thing that women want to get help with, right? Without too much drugs, frequent, intermittent, or insufficient urinary. Then you have your digestion. Oh yeah, it's a big one, right? They say in Chinese medicine, we say the stomach is the noisy organ, right? You eat something, it gurgles or not gurgles or bloated, or everybody wants to look slim, look tall, right? But as you get older, right, your gut starts to get deficient over time, right? So what are you going to do? Some people also have issues with their bile production. Okay, nowadays you've been hearing a lot of people talk about the ketogenic diet, right? In order to be losing weight and bringing down their sugar levels. And it works for a lot of people, but I'm also discovering that my patients with problems with breaking down fats don't do well on that. It really messes them up. So it really depends on what your pattern diagnosis is, and should get some guidance from a licensed professional. Then also there's the endocrine system. I was talking about endocrine disruptors earlier on, yeah, and that cause from stress, and then your human growth development is interrupted, and your personal management systems and reproduction would be disrupted as well. Okay, so when all this information is happening, let's see, yeah, and is happening, right? We look at it on a slightly different way for the TCM practitioners. Okay, so we talk about balance. Okay, that things, and you show this kind of chart to any elementary kid, right? They can tell you, oh, it's opposites, day and night versus fast, slow, outwards, inwards, right? And so, what would balance look like in a body, right? These are like the polar opposites, the extreme different. But when it's together and it's in function, like the chart here, right? What would that look like? Anyone?
No stress and peaceful.
No stress, no peaceful, no symptoms, basically. Yeah. And you'd look alert, right? You'd have energy. You won't be like lackadaisical, right? And then also yin and yang, I wanted to mention too, is that if to us yang type of fluids in the body is also the lighter ones like sweat and tears. Okay, later on I'll explain why I'm talking about this. And then also the yin would be the deeper bodily fluids like the synovial fluid in the joints, the corneal fluid, yeah, And these provide lubrication and nutrition inside the deep parts of the body. These ones are to be lighter and protection as well as detoxification. Yeah? And all of it must be in balance, yes, but as it maximizes and gets to the peak in each side, right? Let's say this is noon time, so it's bright sun, bright young. This is midnight, the opposite side. Already, as soon as we reach the maximum of that, you have 1 second of it is already start to wane. Okay, so that's important because the two pieces of separate and then together, the third piece together means that it's balanced. Okay, so that's simple yin and yang theory. And at the same time, we talk about five element theory, tying in together the emotions and the tissues. And when we're babies, okay, life, it's all about water. The baby drink the milk in and it pees the water out, right? But that's also a time, if you're not properly supported by your family, okay, that's also a time of fear because we're kind of helpless, okay? And mostly we are supported pretty well, and then like you plant a seed into the ground and you grow and it starts to grow, then it'll start grow into a beautiful tree. Yeah, and so you get to the stage of wood, from young childhood, babyhood to young childhood to wood. And then, as you know, teenagers, I have a couple of 11-year-old twins now going on to middle school and to teenhood soon. They are gonna and are already having a little bit more irritation, more anger. Now, most of us reasonably overcome these things, but as you get toward young life, young adulthood, right, the fire stage of life, okay, you looking for love, and that emotion tends to be overexcitation when you kind of you work real hard, you're looking for a job, you're also looking for love, right, and then party late, things get very excitable, and another example of overexcitation might be like in the summertime, right? Before COVID, people have weddings, right? And it's a happy situation. But sometimes, the bride and everybody's like super happy, and it's like, oh, I can't sleep. It's too excitable, and and sometimes characterization of people with this is like if you uh, have you ever met people who for some reason they're always laughing, okay, and you think it's a good thing, yeah, it's good positive people, but like some people just kind of or you've got a group of people together and it's funny and everybody just laughing, and it's like a little bit too much. Okay, so in other words, this idea of fire is like excess, too much, right, and too much heat going on. Then you come down to the earth element with your stomach, spleen, where you're having a worry, anxiety, too much going on, handling too much, and it's supposed to be your abdominal chakra there, but you're not taking enough time for your food, therefore you're not digesting well. Then you're gonna have and sleeping too late, so your schedule's not good. You're not managing life very well, or you are having kids, having your work, having your parents to take care of, and so forth. Okay, so a lot of anxiety, worry in this stage of life. And then as we get the kids grow up, we get to the lung, the metal element, okay, where the kids are all gone. But there's maybe, and the fall season is also at this time right now. Yeah, a little bit sadness, a little bit grief that passing of the peak energy, right? If this stage in life people have respiratory issues, right, then that's when they pop off and the whole cycle starts over again. Okay, so very simple relationship in the five element theory. Related here, the tissues, as you see, kidneys, bone, marrow, brain. Okay, liver, tendon, ligaments, nails, vision. All right. So sometimes when I see people in pain, they have vision pain, then I'm thinking about, okay, there's something going on with their liver. And it has a very interesting correlation. It's not just the symptom itself, but it's related to a whole pattern diagnosis. Okay, so you can read for yourselves here about the heart pumping blood, sweat blood, vessels housing the spirit. So in Chinese medicine, the spirit is very important too. It's not just the physical. We always think it's physical, but more often than not, we're trying to bring balance to the physical body so that it can house properly your energy, your spirit. All right, and stomach muscles go into the stomach and spleen. The nutrition goes in the muscles to help you to focus and concentrate, right? And transform and transport the nutrients all around, right? Lung for sweat, nasal mucus, and housing your corporeal soul. So it's interesting because we say the soul, yeah, housing in the lungs, right? The lungs is more the physical body to help you to take a breath. Okay, that would be your corporeal soul. All right, but once the body physically dies, then what goes on? We say the ethereal soul is in the liver. So if you're a person who's like really irritated, easily agitated, yeah, you have too much pressures going on. So what's happening to your ethereal soul? Maybe you're feeling like therefore you're not connected to the divine, the spirit, right? So no wonder you don't feel like you're fulfilling your purpose. Yeah. And to us in Chinese medicine, we think that's the ethereal soul is the one that um, goes on, and therefore in life rebirth. This is the Chinese system with Buddhism. We think of rebirth, going on to the next one. Okay. So and then on top of that, the yin yang theory, the five element theory, we have meridians theory, as in the invisible channels or lines where your qi or prana flow all through the body. Okay, and so related to the five element earlier, lungs, large intestine with the metal elements, stomach, spleen again, very important with the earth element, heart, and small intestine would be the fire element, water for bladder, kidney, pericardium, and triple warmer. That would be related to like the endocrine system. So I think Chinese medicine covered that basis with this idea of three burners in the abdomen, heart, and the upper part of the body to cover your endocrine. And you have your conception vessels, and governing vessels would be like the spine. And then finally the belt channel here, which is the balance between upper and lower. Okay, so then there are vital substances in the body. Okay, so when I'm treating a patient with acupuncture, with herbs, I'm not just trying to manage their qi or their life force energy. We're also trying to bring balance, right, for the blood in the body, the blood being the material basis of the qi to flow. So without enough blood, the qi cannot flow. Without enough qi, the blood cannot be pushed. It cannot warm it either. Okay, so these two are intimately connected. And then we have another substance we call Jing, or essence. Yeah, like your long-term reserves or adrenals or genetic DNA. If we are under-resourced for too long, we're going on empty, then you will pull down on your long-term, you can say, savings account, right? We keep our short-term in the bank, but we've got our long-term investments. That would be like Jing in essence. And then again, that spirit, that soul energy, corporeal and ethereal. Okay, we have to have enough qi, have to have enough blood. Otherwise, you're not going to have the energy to be connecting to the great divine here. Okay, so and what does spirit look like when a patient comes to see me? That's one of the first things I'm looking. Do they look like they're on? Do they look like they're interested? Right? Do they look lively? But most people would be like, too tired, too sick, too much in pain. Then we have to make sure I'm balancing everything else in order to help that spirit get back in place and thrive. Okay, so TCM, what would cause the pain, therefore? And we say that that's qi pathology, that's blood pathology. Qi would actually be a more intangible form right? So you can have qi deficiency, somebody, and that it's more temporary. But if you don't do it for too long, it's okay. So what do you think would boost your qi, would boost your life force energy?
Better health.
Better health, yeah, but what if you're hungry? You go eat, right? So then you eat food and you have a little bit more energy, right, to last you a few more hours, right? And then supposing you're in a stuffy room, right? You don't feel very good because the air's not good. So you go out to the fresh air when we have fresh air. We don't have our fires going on, right? And we get nourished that way, right? Or you get an air purifier for your house. Anyway, you need food, you need air, good air, right? You need water, fresh water, right? And you'll be rejuvenated. And you're tired, you go and sleep, you can be nourished that way. Yeah, and you also need exercise in order to get the muscles going. Yeah, and strengthen yourself. So if you're not eating enough, right, you'll have qi deficiency. If the qi is sinking, qi for nutrient qi is supposed to be nutritious qi is supposed to go up and nourish the body. But if it's for whatever reason, yeah, you didn't eat something properly, right, it will go down and you end up having the runs in your body. Yeah. And on the other hand, so I've often seen emotional reasons that people are upset. People actually physically feel stuck. Then after that, when I'm doing palpations on the body, it's like I can feel it very tight, very painful, therefore in the abdomen. So that would be like chi stagnation. It's temporary because just with the needles, yeah, a few treatments, it clears up. Then that was a chi stagnation. Okay, and it's often, as I said, from emotions that are stuck. Chi rebellious or counter flow, right? If you ate some food that's not good for you, stomach chi is supposed to go down, right? It breaks it down, it goes down into the intestines, and then if it's not, you ate something bad, it goes the other way. So that's not supposed to happen. Lung chi is supposed to go down as you breathe. Huh? Take a deep breath, right? If it's not going the right way, counter flow, then you'll be coughing, and there would be pain there in the chest. Okay. And if it's for a longer term, if your chi situation did not resolve on the early stages, then it will go down into your blood issues. You can, maybe you haven't been eating really long time. So then I see people, okay, their tongue becomes pale. So there we go. That's blood deficiency or anemia. Okay, and which can also cause pain. Different type of pain, not as acute if they had an excess situation. Okay, blood stasis. Blood stasis, what would that look like? Anybody? Yeah? Would it look bright or will it look dull in the body or wherever it's the issue?
Down.
It would look dull, right? Like when you hit yourself in physical trauma and like, oh, there's a purple spot here. Okay, that's definitely blood that is stasis. And if it goes on for a longer time or you've had endocrine disruptors, you can end up with the cells being abnormal, multiplying too much, not growing enough, not dying off, right? Or becoming misshapen, then you can have tumors. Okay, sometimes we consider some of the fast-growing ones, especially, might be to blood stasis with heat. Okay, it's like multiplying so fast, right? So then they go for radiation and so forth. In this country, acupuncturists wear adjunct support. Okay, but I know that co-workers that I know went back to China and so on. They treat it all with the herbs, with the acupuncture, and it does work. Yeah. So then blood heat would be like somebody with heat stroke, or somebody who maybe is a construction worker working outdoors all the time. Okay, so then they're getting heat, they're getting pain, headache in the head, right? And sometimes there will be migraine. Yeah, too much, and it's just bleeding all over the place. Except for things like heat stroke, I wouldn't see blood heat very often because it would be a real emergency situation. And so even if they came to me, I would be like, you need to go to the hospital right away. They need to calm down your situation and give you fluids and so forth. Okay. And then blood loss would be like excess bleeding. Again, this would be emergency cases as well. Okay, but sometimes you never know. Sometimes some people have things happen to them. They don't trust their MD. They do come see me. So yeah, it just depends on the situation and if it's safe enough. If it is a rapid case, I'd send them to ER right away. Yeah. Okay. So then there's the bodily fluids, right? I said they were yang and yin. The yang, your watery, yeah, uh, like sweat and tears, okay, and it will circulate on the outside. So it's a good thing for us to exercise, as we know, right? Because it helps. In our case, in Chinese medicine, we say it helps with your immunity, with your defensive qi on the exterior of the body. Sometimes it's misfunctioning too, and so I've had patients who have no sweat. Okay, with all these pores, it's important to sweat because it's detoxifying. But some poor patients, they have, it's called anhydrosis. They don't have sweating, and so it's hot in the body. It's heat, but that's also an obstruction. That's also a pain, right? So very important to get people to be able to be sweating, and there are herbs for that. There's acupuncture for that too. Okay, and the yin liquids would be the turbid, heavy, dense ones for providing nutrition to those sense organs. Okay, and within the interior for like helps with the corneal eye fluid and synovial fluid in your knees, right? So for joint problems like arthritis, there's something going on with your fluids. So we'll talk about that, about what we can do to help with pain issues that happen. Any questions so far? Yes, no, maybe? No? Okay, I'll go on. All right, so there's we call climatic factors, means the external weather, okay, tends to also affect our body, and it also seems to appear similarly in the body. So who here has like pain, right? Arthritic pain, and it's like, you ever heard people say, I can tell the weather with my joint pain? Yeah. I can tell it's gonna be raining and it's gonna be really, really cold. And the more painful it is, right? The more I know it's coming. It's coming fast, right? So yeah. So the cold affects it, and it will affect your low back oftentimes. Okay? The kidneys are more susceptible. Sometimes it tends to be a fearful person constitutionally for whatever reason in their life, Some people victimize themselves, some people have issues. When I was young, when I had all that back pain, I did have quite a lot of worry and fear going on in my body as well. Okay, so the cold will contract and stagnate because it like shrinks the blood vessels, right? And so it will be painful. Okay, you guys can look over. I'm just gonna do some highlights, and then there's also what we call wind, right? Sometimes who here has had joint pain that, raise your finger, raise your hand if it moves from place to place. It like that does not stay, right? Yes, you're rubbing the hand, the arm, right? But it's like, it's here. No, not here. Now here in the hand, and it's so painful, right? My grandmother used to tell me these things. I never understood about it. And then it can therefore cause sudden rigidity, and sometimes also people have dizziness going on too. It's just like the wind is blowing inside the body. This is because the endocrine system or your stress management system is off. So that would affect what we say the liver system. Okay, and I would treat that. Sometimes certain foods are also affected too. Yeah, and pain, migraine, headache, pain often. Sometimes people are affected by eating chocolate. Yeah, ever had that before? You eat chocolate and it's like, oh, painful, painful. I know I'm not supposed to eat, but the chocolate's so good, you know. So yeah. And again, the fire and summer heat is the excessive warm and heat in the body. My typo there. And also from fevers, from heat stroke, it causes your chi to rise up quickly, yeah, and your headaches. You ever had that before? And sometimes people also changing right from AC in the summer to the heat out there, or from the heat going into AC. It's like it hurts. Okay, it's just a quick change, right, in the blood vessels, right, and that will cause pain. Basically, it affects your blood flow. All right, and then dampness, right? Dampness, you might recognize this because maybe the joints are swollen. Okay, they're puffy, they're fat, right? So that means the exchange of fluid, because blood has the blood platelets, blood corpuscles, they have white blood cells, red blood cells, protecting us, but it's supposed to have that osmotic interchange uh, between the fluids in the body and the blood to nourish your organs. But if it's not working out well, then it causes inflammation in there too. So that would be like dampness. And oftentimes people's food affects it too. And then the people have dryness, right? They're not, again, as I said, not sweating properly. There's something going on with the protective chi in the body. So it just dries it up and itchy. And so especially this time as the weather starts to get cooler, right? Anyone have like itchiness in the skin? Okay, also to the fact that it's painful. Yeah, right? You have dry cough, mouth, nose. So this is the time especially, okay, to really make sure that you're hydrating enough, and then you drink warm teas, right, and you have soups. Okay, so very much I find Chinese medicine very practical because it helps us to manage our energy through the different seasons, because it's not separate from us, right? We all need to live in sync with nature. Okay, so moving along, joint pain, arthritis. So what does that mean? Okay, as I said before, that fluids in the body not flowing well, it affects your transformation, transportation, and therefore affecting the spleen, stomach. So you are what you eat. Okay, so stomach and spleen would create from the food that you're eating, and if it's not flowing properly, it creates dampness, phlegm in the body. Okay, but it will look different for different people. It can have cold damp, okay, and swollen and fat or edema. It can be damp, which is kind of a worse condition. In the picture here, it would be damp heat because you see this person's joints are like red. Okay. I once had a patient who oh, yes, living up in San Francisco. Often people San Francisco with the mist and fog, right? They have damp phlegm and cold phlegm, very cold, right? And painful, tight, painful. And I said, why don't you move down to the South Bay? And so she moved in with her daughter and down here in South Bay, and then it got better. Okay, just by climatic changes too. Yeah, but not all of us can move, so we do the best we can. Okay, so the emotions, how is it affecting us? 7 negative emotions effect on the pain. You have fear and shock, liver, anger, heart, overexcitation, mentioned already, spleen, worry, pensiveness, lung, sadness. So one story that I have about kidney fear and shock, right? My classmate from years ago, she had 2 daughters. One's autistic and one's a younger child who's regular, normal. Okay, and then she was having to help the younger child with the seat belt in the car. The next instant, she looked up. The autistic child is gone. She doesn't know where she is. She's gone. She's so frightened of where she's gone to call the police and so forth. But she said she had to still hold it together because she has a younger child. The police finally found the girl, and she was walking in the middle of 280. Okay, they got her, and everything was fine. But I tell you, she went home, her pants was totally wet because she was so scared. So she basically literally peed on her pants because she was scared. All right. And then 1 or 2 days later, hair fell off her head. So that's my classic story of what fear can do to your body. And it's a real thing. It is a real case, real situation. People are too scared, too frightened, or too whatever it is. It will affect your transportation, exchange of body fluids, and causing pain. Therefore, it's just telling you it's a blockage, and we need to do something about it. We need to support it. We need to resource our body better. So TCM treatment methods, okay? The main thing that we're doing, all this is stress, whether or not from external, all the 6 factors before, or internal, the emotional. Emotional, we have the most control over. And we need to relax the body and regulate your vital substances back to balance. So what we can do, we have 5 branches of TCM. We have acupuncture, bodywork, massage, we call Tuina or Anmo, herbal therapy, dietary therapy, yeah, and medical qigong or exercise. Okay, and we need to balance out the body to bring it back. Okay, and then acupuncture techniques I have is needles or with e-stim here. Sometimes that helps move the qi better in the body. Cupping, couple of techniques I do with this is the air cupping with a pump, and then fire cupping, also both to create a vacuum, and it feels like a good deep massage. Okay, and this actually helps with moving the blood. Okay, so it's a slightly deeper technique than the acupuncture. Acupuncture is a little bit more on the surface with the chi. Okay, and then some people have that extra heat. Again, I use something like scraping, which is to with a little bit of massage oil, and we get the stuck blood out. Also very comfortable, feels like good massage. And moxa is for people who are cold to move and dry up the warm the body and dry out the damp. Okay, and sometimes the blood stasis and maybe like sore throat pain, I might prick and bleed the thumb here, and it also relieves sore throat really well. Yeah, especially for children, it moves it quickly. All right. So body work techniques, you can do rubbing, okay, with your body with a supported thumb. Means hold your thumb with your fist so that you're not straining it, okay? And you can roll it and press with your thumbs. Yeah, that always feels good. Shaking it, okay? Pulling. These are things you can do for the joints. Yeah, pop it. Have you ever? Yeah. If you're getting a good session, then it feels really. And people can do the toes, right? And pointed tapping, you would have the sound, okay? And so on the hands and wrists, these are the points here. Very good for headache, dizziness, and also there's heat in the body. The thenar eminence here feels good to rub that. And also around the wrist, this can also help with the spirit gate, helps you to sleep better. Okay, the one at the base of the head here, if you are a cold person, this helps with regulating temperature. So a cold person, when you're having shower, have the shower hit there, it feels really good. My kids, children often have a lot of heat, a lot of yang in them because they're young. So my kids have nosebleed. One of my twins has nosebleed, so we've actually put a cold compress or ice pack there. That helps a lot. It like stops it almost immediately, which is nice to know. I let the teachers know so that they can deal with it and not have drugs, not have to call anybody, have an ice pack, fridge in their classroom when they go back, easy. And then, of course, rub around the elbows. That helps. Okay. So herbal therapy, you only do these with the advice of your licensed medical professional. Sometimes they have the pain patches now. I think even the Western companies, Icy Hot's getting into it, but this is actually originally Asian. And the patches have the medication in there you can place on your joints, and that really helps and it warms you up as well. Okay, so some of these herbs, corydalis, camphor, white peony root, gentiana, all this helps with relieving pain. And also turmeric, yijing. I think in Ayurvedic culture, you guys have the golden spice milk, right? So turmeric is really good for reducing inflammation. To get the curcumin out, you would need black pepper and maybe like an oil, coconut oil or ghee, because the oil would help to break the blood-brain barrier and bring it up to the brain. Okay, so if you're just using turmeric alone or with those pills, not going to work. It needs the black pepper, it needs the oil in order to work. So use that with the spice milk, with the plant-based milk, that works really well. So it's both herbal as well as dietary therapy. And there's also a barley. Iiran is the larger barley, not the small pearl barley. It helps to dry up the spleen and to reduce the damp in the body so that you won't get so puffy. And also, one thing is that it will help you to pee more. Okay, so people with edema, pain, yeah, will be doing that a lot more. But it feels really good because finally they are excreting properly. Yeah, I have some of my patients do that, and it feels really good after a while. Yeah, it won't happen right away, but over time, it's something you can do at home. Okay, so then I have an dietary therapy, an anti-inflammatory meal we should have. More plant-based, minimal meat, large portions of fruit, vegetables. If you're cold, so add more cinnamon in your cooking. Okay, If you're damp, I already mentioned about the barley, okay, and increase your fermented foods in order to feed the intestines. Yeah, reduce sugar, excessive alcohol intake to help with the liver, help with the spleen. Okay, the regular schedule is important because you want to allow the system to rest. And so 3-4 hours before bedtime so that you can have the more restful night's sleep, which will reduce your inflammation. Okay, and intermittent fasting increase your body metabolism to maintain balance. So we should always be eating. Chinese medicine, we say about 80% of full. Okay, don't overeat because then it will just get stuck in there. Okay, and when we're sleeping and overeat too much, get bloating. Okay, finally, medical qigong, gentle, non-impact, round circular movements, exercise to support your joints, ligaments, and tendons. That will help to support your liver. Okay, you got 6 big joints: shoulder, elbow, wrist, hips, knees, ankles, to move in a coordinated way. All right, to calm the body, calm your awareness down. Make sure you have regular targeted movement, like you're walking or swimming, cardio, right, to help your heart and push the blood out. Okay, regular strength training. I always say strength training and core strength particularly is non-negotiable. Every single sport I've ever done after I started getting well, the core strength has been very important. Okay, and dance or qigong or complex movement patterns so as to keep the mind sharp and healthy. Okay, so that your brain will also not have so much difficulty and pain and can be clear. Okay, and we all need a good faith practice with an attitude of gratitude to give your life purpose and meaning, and then we feel content and happy. Yay! Reduce the pain, right? So still in a chair, okay, and try to be in a chair where your back is away from the back of the chair, so that the main thing here is that we want to be able to move the spine. So just simply rubbing around the knees. Can you see me? Yeah?
Yeah, we can see it.
Because a lot of people have, as I said, the knee pain, right? And moving the wrist here around also helps to open the joints there, right? And when you go forward, relax down. There'll be maybe a little bit of an ab crunch toward the end. And then inhale, pull it up. And as you're breathing, the tummy's coming more toward the spine. So that then you release. So that's a way to also begin a gentle, easy core strengthening. Okay, most of us, when we're in pain, we can't do much at all, right? And I really couldn't do much at the time, even though I was pretty young. And the acupuncturist who told me, you have to do the medical qigong, otherwise it'll come back. Okay, I can cure you, she said, but you got to do it because stress is all the time, every day. Right? So just do this simple little one is good. And then you can also do a reverse, therefore, pulling up the inside, going down the outside. And as many times as you like, as is comfortable for you. When you go up, you inhale. Down you exhale. Good. Right? And you will reverse again. You can even therefore be standing up after that. I'm not sure how the screen would work for me to be standing up. So as if you went around the knee, right? And then now you're doing it standing up. Inhale, exhale down. In, ex, inhale, ex. Good. So this would be called row, row your boat. Nice. Right? So it's basically that circle that you're going down the inner side, up the outer side around the knees. We've expanded it to be a little bit bigger. And round circular movements are gentlest on the joints. And inhale, reverse it. Exhale. This is like a reverse rowboat. Or my teacher calls this knead the dough. The idea is that you're pushing down with the base of the palm. And then allow your elbow to be open. When it's all open, then let your pelvis, your hips sink down. No struggle at all. On the down, because you just let gravity do its thing. Good. Yeah. 3, 2, 1. See, it's yeah. So then these are parallel to the ground. Hold on. Circles parallel to the ground.